I'm Dr. Cynda Rushton, the Bunting Professor of Clinical Ethics and Nursing at the Johns Hopkins University, and I'm joined today with my colleague, Dr. Laurie Leitch, who is the founder and director of Threshold Global Works, which is an organization that is dedicated to helping people heal from trauma. So today we are continuing our series, looking at how we can actually use some very practical skills to address some very common moral and ethical issues that we're confronting in the context of the COVID-19 crisis. So today we are going to focus on the issue of moral outrage. And I doubt that there's any person who is not experiencing moral outrage, that sense of violation of some important value, a sense of injustice that has occurred either toward ourselves or toward groups of people. And the often anger and energy that goes along with that recognition and how it impacts us. You know, in many ways, moral outrage is an expected and often justified response to a real or perceived violation of an important ethical value, especially things like justice and fairness and equity. And so it's not as if moral outrage is, you know, something we want to try to extinguish in any way. But rather, how do we use moral outrage in a way that can be constructive and actually motivate us to progress, to come up with solutions, to acknowledge the very real value conflicts that are in front of us? So one of the common ones in my world as a clinician and a healthcare provider right now is around the availability of personal protective equipment, or PPE. And I'm sure people have seen on the news and in all kinds of publications the sense of moral outrage that goes along with the recognition that we actually do not have sufficient amounts of PPE for our frontline healthcare professionals. And as a result of that, many of them are experiencing extreme degrees of risk in terms of their own health and that of their family. But sadly, in addition, we are seeing clinicians who are developing the COVID-19 virus, and some of them who are dying. And so the outrage is really fueled by how is it that we can have a healthcare system that asks our clinicians to put their own health and well-being at risk in order to serve the health and well-being of all the rest of us without having the kind of equipment that actually decreases the likelihood that they will be either infected themselves or harmed by contracting the virus and potentially dying. So I'm wondering, Laurie, if we could talk a little bit about how the social resiliency model might offer some tools for how we could approach our moral outrage in a way that might be a little bit more constructive and a little less exhausting.
Okay, well, that's a big question, huh? And just the word outrage. I mean, when I hear the word outrage, much less know what you're applying it to, so I can even see the scenes, and I can start to feel in my own body that constriction, because I felt outraged myself watching the news, hearing from people in my world about what's going on and how can this happen. So that word outrage immediately makes it really big, and we know that as soon as it's named that it comes with a lot of other things. And so from this neuroscience-based model, we can talk about the slow and fast system of information processing. And in the slow system, it means that no major threat has been detected by our little smoke detector, the amygdala. And we can operate in this sort of congruent way where our thoughts and our feelings and our sensations are all fitting together, and we're in what, in my model, we call the resilient zone, the R zone. And in that slow system, of information processing, we can think clearly and strategically, and we can make really good decisions in our own behalf and in behalf of others. This is in contrast to what happens in the brain when we have a situation like outrage, where we go immediately into the fast system of processing, where the stress chemicals that are produced block access, full access to your cortex or thinking brain. So this is a kind of scientific explanation of something that's horribly personal to so many people, but it can help to understand what's going on and why it's so important to have some tools that you can use in your own behalf. And so when the stress chemicals start to block clear thinking, we can forget about things, we can lose things, we certainly have an escalation of emotion or shutdown of emotion, either of which isn't good for our work, but also for our immune system, which is a big focus of mine. And so the first step is when you're in a state of outrage, you're already outside of that zone. And so cognitive strategies are generally not going to be too helpful. The worst thing somebody can say to you usually is calm down. It just makes you all the more furious because your fury is grounded in a reality. You deserve to be outraged about it. It's just that you can't act strategically, both in your own behalf for your health and your professionalism, or in behalf of others. And so what can you do? The first step is that to just notice. If you notice that you're constantly going over and over and over what's gone on and getting more and more activated by that, that helps you know that you're getting into that state, and you can begin to do something else. You can at least give yourself a breather by shifting your attention. In this model, we work with the power of attention. It's a powerful tool that we have, and we don't pay enough attention to it. So that whatever we pay attention to is going to create the climate in our body. That's the simplest way to say it. And so as you notice that your outrage is present and active in you, if you can simply take a step by focusing your attention down to the soles of your feet being supported by the floor, that small, the soles of your feet being supported by the floor, and just sense in that moment. Nobody needs to know you're doing it. You can be in the middle of an ICU. You can still maintain your focus, your visual focus on what's needed of you, at the same time as you send your attention down to the support of the floor underneath your feet. And you just push in a little more deeply, just to remind yourself that you're being supported by the floor. And for many of us in that moment, and particularly if you practice this as simple attentional skill, grounding, you begin to notice a little lightening of the sensory experience of outrage. You may take a little deeper breath just for a moment. You may feel as if your shoulders drop. You may notice something if you're tracking yourself at that sensory level. If you don't notice a difference, then it's important to shift your attention in some other way. So maybe you shift your attention to a coworker across from you, and you notice how hard she's working to try to correct a situation. And you notice that she's diligent about what she's doing, and then maybe she meets your eyes. And in that moment, you have that brief human connection of, we're in this together. You matter to me. And you just allow that to go into your body in a way. You take it in at that sensory level, that human connectedness. And you just stay with it for just a minute. You put your attention there. And as you notice your activation level dropping a little bit, your thinking, your better ability to think will come back online bit by bit. You can participate in decision making in a way that isn't so reactive. You can advocate for what you need from a much more constructive place, because nothing in learning to manage moral outrage is about the fact that you have no right to be outraged, because you have every right to be outraged. It's just that, does the outrage serve you? Either serve your own personal health, emotional and physical, or serve you as you try to do the best job you can do with what you have. And so that's what's important to remember, is that in using these attention-based skills, it's not because we want to try to make some reality go away. It's only that we want to embed the reality in something more that balances out the toxic toll it takes on your body, on your mind, on your capacity to act strategically in your own behalf and in behalf of others.
So this skill is a really important one for all of us right now, because I think the tendency and the opportunities for moral outrage are ever present. And we're in a situation where we could easily become completely depleted by allowing the moral outrage to actually stress our system even more than it's already stressed right now. Mm-hmm. And so, as Laurie was describing, part of the reason to use these skills is so that we can actually get ourselves back into our resilient zone, where we can perceive the situation clearly, be able to connect it to our ethical values, to be able to name why this is so outrageous and wrong, and then to be able to decide to choose. Because when our amygdala is taken over, we're not in a good position to choose, because we're often in autopilot. And so when we're in autopilot, we're more likely just to spew our anger everywhere. And that might feel good in the moment, but the consequence can be that we actually cause more harm to ourselves and more harm to others. Because if you think about being able to speak up, often we're not heard if our voice sounds shrill, if it sounds judgmental, if it sounds self-righteous. And so I think this helps us to be able to harness that energy that's produced by that moral outrage, and to use it to guide our thinking and our advocacy in ways that are actually constructive. So to be able to step back and say, well, what else is possible here? You know, where are the additional resources? How do we advocate for increasing the availability of PPE? What are those strategic decisions that we need to engage? Maybe we need to work with our professional organizations. Maybe we need to work with our leadership in our own institution. Maybe we need to create allocation protocols for how we will allocate this scarce resource. All of those may be ways that can move us out of that sense of feeling completely powerless as well, that there's nothing we can do, to being able to recognize that in the midst of this incredible crisis in healthcare right now, that there are still opportunities for us to actually use our commitments and our passion to our patients and to our profession to create good, despite the limitations that are currently in front of us.
Well, and it tells us that we can't do any of that very successfully if we're in a fast system of information processing.
Right.
And so as we learn how to take to use these very basic skills, but they're grounded in brain neuroscience, as we use them to bring ourselves back into the slow process, we can be much more effective in all of those. And so, without trying to be too cutesy about it, I was telling Cynda before we started that I've started to posit the idea of calling these skills PPSs, because they're protective, personal protective strategies, PPSs. So, and they're always with you. No one can take them away. They never get depleted. They're yours to own and yours to share. So I hope that you take that with the spirit that it's offered to really develop your PPSs.
So I want to thank Dr. Leitch for joining us today, and I hope that you will take something from this brief segment that will support you in responding as you do every day to the ethical challenges and to the reality created by the COVID-19 pandemic, to support you and your integrity and your well-being. Thank you for what you're doing every single day on behalf of all of us.